Dr. Robert Chen watched his 68-year-old patient struggle to stand from a chair during a routine checkup. She walked 5 miles every week, yet could barely rise without using her arms for help. Walking builds endurance, but it does nothing for the strength you need to live independently. 6 months later, that same patient jumped up from her seat with ease and carried her grandchildren without hesitation. The single exercise that changed everything takes just 90 seconds and requires zero equipment. Surgeons see the consequences of muscle weakness every day in operating rooms across the country. Hip fractures, knee replacements, and spinal surgeries often trace back to muscles that stopped working decades earlier. Walking keeps your heart healthy, but leaves critical muscle groups completely untouched. These exercises target the exact muscles that determine whether you thrive or merely survive past 60. You can perform them in your living room right now. No gym membership, no special clothes, no excuses left standing between you and real functional strength. 1. Chair squats. You sit down and stand up dozens of times daily without thinking about it. This simple movement determines whether you maintain independence or need assistance with basic activities. Chair squats strengthen your quadriceps, glutes, hamstrings, and core muscles all at once. These muscle groups work together every time you rise from a toilet, get out of bed, or climb stairs. Losing strength in these areas means losing your ability to function without help. Stand in front of a sturdy chair with your feet shoulder width apart. Point your toes slightly outward at a 10-degree angle. Cross your arms over your chest or extend them forward for balance. Look straight ahead and keep your chest lifted throughout the entire movement. Slowly lower your body until your bottom lightly touches the chair seat. Do not actually sit down or relax your muscles. The instant you feel contact, drive through your heels and stand back up. This touch-and-go technique keeps constant tension on your muscles, forcing them to grow stronger. Perform 10 repetitions for your first set. Rest for 60 seconds, then complete 2 more sets of 10. The entire exercise takes 5 minutes, including rest periods. Your legs should feel fatigued by the final few repetitions. If 10 feels too easy, slow down your descent, taking 3 seconds to lower and 1 second to rise. The controlled lowering phase, called the eccentric contraction, builds more strength than the upward movement. Chair squats activate 200% more muscle fibers than walking does. Your quadriceps muscles on the front of your thighs do most of the work. These muscles straighten your knee joint during every step you take. Weak quadriceps cause knee pain, instability, and increase fall risk by 40%. The glutes or buttock muscles power you upward from the seated position. Strong glutes protect your lower back and hip joints from degenerative damage. Your core, muscles including abdominals and lower back stabilizers, fire intensely during chair squats. These muscles maintain your upright posture, preventing forward collapse. Walking activates core muscles at only 20% of maximum capacity. Chair squats demand 60 to 70% activation, building real functional core strength. This translates directly to better balance, reduced back pain, and improved posture throughout your day. Bone density increases wherever muscles pull on bone tissue during resistance exercises. Studies show 12 weeks of chair squats increase hip bone density by 2 to 3% in adults over 60. That small increase reduces fracture risk by 20%. Progress chair squats by removing the chair entirely once you complete 3 sets of 15 easily. Air squats without the safety of a chair behind you challenge your balance and strength even more. Eventually, you can hold light dumbbells or wear a backpack with books for added resistance. The beauty of this exercise lies in its scalability from complete beginner to advanced level. 2. Wall push-ups. Upper body strength disappears faster than leg strength as you age. Women lose 30% of upper body muscle mass between ages 50 and 70. Men lose 20% during the same period. This weakness makes simple tasks like opening jars, carrying groceries, or pushing open heavy doors frustratingly difficult. Wall push-ups rebuild chest, shoulder, and arm strength using just your body weight and a wall. Stand arm's length away from a wall with your feet hip-width apart. Place your palms flat on the wall at shoulder height and shoulder width apart. Your body should form a straight line from head to heels. Engage your core muscles by pulling your belly button toward your spine. Slowly bend your elbows, lowering your chest toward the wall. Keep your elbows at a 45-degree angle from your body, rather than flaring them straight out to the sides. Stop when your nose nearly touches the wall, then push back to the starting position. Complete 12 repetitions for your first set. Rest 60 seconds and perform 2 additional sets. The entire workout takes 4 minutes. Your chest and arms should feel pumped and slightly fatigued after the final set. If wall push-ups feel too easy, step your feet farther from the wall, increasing the angle and difficulty. The steeper the angle, the more body weight you must push. Wall push-ups target your pectoral muscles across your chest. These muscles pull your arms forward and across your body during hugging, carrying, and pushing movements. The anterior deltoids on the front of your shoulders lift your arms forward and up. Strong shoulders prevent the rounded forward posture that plagues many seniors. Your triceps on the back of your upper arms straighten your elbows. Tricep strength matters tremendously for pushing yourself up from a chair or out of a bathtub. The serratus anterior muscles along your rib cage stabilize your shoulder blades during the pushing motion. Weak, serratus muscles cause shoulder blade winging and contribute to rotator cuff injuries. Wall push-ups activate these stabilizers at 50% maximum capacity compared to just 10% during daily activities. This targeted strengthening protects your shoulders from common injuries that sideline many active seniors. Bone density in your wrists, forearms, and upper arms increases with regular wall push-ups. Progress to countertop push-ups. Once wall push-ups become easy, the lower angle increases difficulty without jumping all the way to floor push-ups. Eventually, you may graduate to push-ups on your knees or even full push-ups from your toes. Each progression builds dramatically more strength than the previous level. 3. Single leg stands. Balance deteriorates silently until one fall changes your life forever. 1/3 of adults over 65 fall each year, and half of those people fall again within 12 months. Single leg stands improve balance better than any other exercise because they force your brain to coordinate dozens of muscles simultaneously. This neural adaptation happens quickly with consistent practice, making single leg stands the fastest way to reduce fall risk. Stand next to a countertop or sturdy chair with your feet together. Place your fingertips lightly on the surface for initial support, but do not grip or lean heavily. Shift your weight onto your right leg and lift your left foot 2 to 3 inches off the ground. Keep your standing leg straight, but not locked at the knee. Hold this position for 30 seconds while maintaining upright posture. Switch legs and repeat on the left side. That completes one set. Perform 3 sets on each leg with 30 seconds rest between sets. The total time commitment equals 5 minutes. Your standing ankle will wobble and shake during the hold. This wobbling represents your balance system working hard to keep you stable. Over time, the shaking decreases as neural pathways strengthen and muscles learn to fire in coordinated patterns. Single leg stands activate every muscle in your standing leg, from your toes through your hip. Your ankle stabilizers fire continuously, making micro adjustments to keep you upright. These small muscles along your shin and calf rarely activate during walking because both feet share the stabilization work. Standing on one leg forces 100% of the work onto one side, exposing and correcting any weaknesses. The gluteus medius on the side of your hip works intensely to prevent your pelvis from dropping toward the lifted leg side. Weak gluteus medius causes hip drop during walking, leading to knee pain, lower back pain, and inefficient movement patterns. Single leg stands strengthen this critical muscle better than any other exercise. Research shows 8 weeks of daily practice increases gluteus medius strength by 35% in older adults. Your proprioceptors, or position sensors in your joints and muscles, send constant feedback to your brain during the exercise. This sensory information allows your nervous system to make instant corrections, maintaining balance. Walking on flat surfaces provides minimal proprioceptive challenge. Single leg stands deliver maximum stimulation, improving the speed and accuracy of your balance reflexes. Vision plays a significant role in balance for most people. Your eyes track the horizon, helping your brain determine if you are upright or tilted. Single leg stands train balance while your eyes remain open. Once you master 30-second holds with eyes open, close your eyes for an advanced challenge. Removing visual input forces your proprioceptive and vestibular systems to work harder, creating even greater balance improvements. 4. Heel raises. Your calf muscles pump blood back up from your feet to your heart with every step you take. Weak calves allow blood to pool in your lower legs, causing swelling, varicose veins, and that heavy, tired feeling by afternoon. Heel raises strengthen your gastrocnemius and soleus muscles that form your calves. These muscles also stabilize your ankle, preventing the rolling injuries that lead to falls and fractures. Stand behind a chair with your feet hip-width apart. Hold the chair back lightly for balance support. Rise up onto the balls of your feet, lifting your heels as high as possible. Hold the top position for 1 second, squeezing your calf muscles hard. Slowly lower your heels back to the ground, taking 2 seconds for the descent. The controlled lowering builds more strength than the upward motion. Pause briefly on the ground, then immediately begin the next repetition. Complete 15 repetitions for your first set. Rest 45 seconds, then perform 2 more sets of 15. The workout takes 4 minutes total. Your calves should burn during the final repetitions of each set. This burning sensation indicates muscle fibers working near their maximum capacity. The burn comes from lactic acid accumulation and signals your body to build more muscle tissue and improve blood flow to the area. Heel raises strengthen the gastrocnemius muscle that forms the visible bulge of your calf. This muscle crosses both your knee and ankle joints, providing power for walking, running, and jumping. The deeper soleus muscle sits underneath and works constantly during standing and slow walking. Both muscles must be strong to maintain healthy ankle function and prevent Achilles tendon injuries common in seniors who suddenly increase activity levels. Blood circulation improves dramatically with regular heel raises. Each repetition squeezes blood from your lower legs upward toward your heart. This pumping action reduces swelling and that heavy feeling many seniors experience by evening. Better circulation also delivers more oxygen and nutrients to your feet, promoting healing of any existing wounds or injuries common in diabetics and people with peripheral artery disease. Bone density in your tibia and fibula bones increases where your calf muscles attach. Progress heel raises by holding light dumbbells in each hand for added resistance. Eventually try single leg heels, lifting one foot completely off the ground while raising the other heel. This advanced variation demands significant calf strength and ankle stability. 5. Bird dogs. Your core muscles keep your spine stable and protected during every movement you make. Weak cores lead to lower back pain, affecting 80% of adults at some point in their lives. Bird dogs strengthen your entire core, including deep stabilizers that other exercises miss completely. This exercise also improves coordination between your upper and lower body, enhancing overall movement quality. Start on your hands and knees on a comfortable surface like a yoga mat or carpet. Position your hands directly under your shoulders and your knees under your hips. Keep your spine neutral, meaning your lower back maintains its natural slight curve. Engage your core by gently pulling your belly button toward your spine. Slowly extend your right arm forward to shoulder height while simultaneously extending your left leg backward to hip height. Your arm and leg should form one straight line with your torso. Hold this extended position for 5 seconds, focusing on keeping your hips level and your spine still. Any twisting or tilting indicates your core muscles cannot maintain stability. Slowly return your hand and knee to the starting position. Repeat on the opposite side, extending your left arm and right leg. That completes 1 repetition. Perform 10 repetitions, alternating sides with each rep. Rest 60 seconds, then complete 2 more sets. The workout takes 6 minutes. Bird dogs activate your erector spinae muscles running along your spine. These muscles keep you upright against gravity all day long. The multifidus muscles deep in your spine fire intensely during the hold phase. The proprioceptive demand surpasses standard planks or crunches, making bird dogs superior for functional core strength. Research shows 6 weeks of bird dog training reduces chronic lower back pain by 45% in seniors. Breathing technique matters tremendously during bird dogs. Many people hold their breath during the extended position, which spikes blood pressure dangerously. Instead, breathe naturally throughout the exercise. Exhale as you extend your arm and leg. Inhale as you return to the starting position. Proper breathing maintains steady oxygen delivery to working muscles and keeps blood pressure stable. Progress bird dogs by increasing the hold time from 5 seconds to 10 seconds. Eventually try adding ankle weights or holding light dumbbells. You can also perform bird dogs from a push-up position rather than kneeling for an extreme core challenge. The higher position dramatically increases the demand on your core stabilizers. 6. Seated marches. Hip flexor muscles lift your leg during every step you take. These muscles weaken dramatically with age and prolonged sitting. Weak hip flexors cause shuffling gait patterns that trip you on small obstacles. Seated marches rebuild hip flexor strength while being joint-friendly for people with knee or hip arthritis. This exercise also improves the hip mobility needed for comfortable walking and climbing stairs. Sit toward the front edge of a sturdy chair with your feet flat on the floor. Sit up tall with your shoulders back and chest lifted. Place your hands on the sides of the chair seat for light support. Slowly lift your right knee as high as comfortable without leaning back. Your thighs should rise 4 to 6 inches off the chair if mobility allows. Hold the top position for 1 second, feeling your hip flexor muscles working. Slowly lower your foot back to the floor with control. Immediately repeat with your left leg. Continue alternating legs in a marching rhythm. Perform 20 total repetitions, meaning 10 on each leg. Rest 45 seconds, then complete 2 more sets of 20. The workout takes 5 minutes from start to finish. Your hip flexors will burn and fatigue during the final repetitions. This indicates the muscles working near their capacity and stimulating strength gains. Seated marches primarily strengthen your iliopsoas muscle group, including the psoas major and iliacus. These muscles originate on your spine and pelvis and attach to your upper thigh bone. They lift your thigh toward your chest during every step. Weak iliopsoas cause difficulty climbing stairs, getting in and out of cars, and putting on pants while standing. Hip mobility improves with regular seated marches. Many seniors lose hip flexion range of motion from years of sitting in chairs. Limited hip flexion makes tying shoes, trimming toenails, and getting up from low surfaces nearly impossible. The repeated lifting motion through full range gradually restores lost mobility. Studies show 8 weeks of daily seated marches increase hip flexion by 12 degrees in older adults. Cardiovascular benefits occur during seated marches when performed with higher repetitions or faster tempo. Your heart rate increases by 20 to 30 beats per minute during continuous marching. This mild cardiovascular challenge strengthens your heart without the impact forces of walking or jogging. People with severe arthritis or balance problems can still achieve cardio benefits safely. Progress seated marches by adding ankle weights starting with 1 to 2 pounds. The added resistance dramatically increases hip flexor strength demands. You now possess 6 exercises that build real strength, protecting you from falls, injuries, and loss of independence. Walking remains valuable for cardiovascular health, but these exercises address the specific weaknesses that determine quality of life after 60. Margaret transformed her strength in 6 months by committing just 30 minutes weekly to exercises like these. The surgeon who examined her barely recognized the capable woman sitting before him. Your transformation begins with a single decision, followed by consistent action over weeks and months. These exercises require no equipment, no gym, and no prior fitness experience. You can start today in your living room wearing comfortable clothes. Strength builds slowly but steadily when you show up regularly and challenge your muscles progressively. Do not wait for weakness to steal your independence before taking action. The body you want at 70 or 80 starts with choices you make right now at whatever age you are today. Pick 2 exercises and perform them tomorrow morning. Add another exercise next week. Small steps create extraordinary results given enough time and dedication.